So good evening, everyone. I'm Fatima Zerriouh. In today's presentation, I'm going to present for you an outbreak of scabies that happened in Hakama, Jordan during February-March 2017. So scabies affect every people, regardless of social classes. A highest rate or outbreaks occur in communities where overcrowding, poverty, and poor hygiene coexist. In Jordan, scabies is not a notifiable disease, and the last outbreak of scabies occurred in 2013 at a Syrian refugee camp, Zaatari camp. And since then, no more scabies outbreak has been reported until Monday, February 27th, 2017, where the surveillance medical officer reported an increase of scabies cases that happened in Hakama. Hakama is a small village of Irbid Governorate located north of Jordan. So our study is to determine the extent of the outbreak and describe its epidemiological characteristics in order to make recommendation to prevent future outbreaks. So an investigation was carried out from February 28 to March 17, 2017. A special team was constituted and visited the area and started to collect cases according to a case definition. So the case definition of the suspected case was any person living in Hakama who experience itching, especially at night, and rash at the affected body part from February 1st, 2017. 6 skin scraping at different affected body sites were performed into patients by professional healthcare workers, and the microscopic examination was positive for scabies. Mobile clinics in school and house-to-house active surveillance were conducted to find cases in the entire area. And this is true of our colleagues conducting the active surveillance. Data were collected using developed case investigation form on demographic data, which are age, gender, school attended, nationality, address, and date of diagnosis. And data were analyzed using Excel 2010. So at the beginning, until March 20th, the total number of cases was 461 cases with an overall attack rate of 2.9%. And at the beginning of our investigation, there was a cumulative number of more than 40 cases. And after the reporting and the active surveillance cases continued to increase, reaching a peak of more than 100 cases per day. And after that, the cases started to decrease and became scattered over time. This is percentage of scabies cases distributed by age group. The age ranged from 1 year to 85 years with a median of 12 years. Scabies cases occurred in all age groups, but the most affected age group was the age school group. Syrians accounted for 16% of all cases. This is percentage of scabies cases distributed by school. The village has 5 public schools and 5 private schools. So the highest percentage were in the public school. It is important to know that in this village, the public schools are separated in 2 different periods. The morning period is for Jordanian students, and the afternoon period is for Syrian students. So we were able to determine the denominator and calculated separately the attack rate and which vary significantly from 9% among Syrian students to 4% among Jordanian students. So this is on the right. This is Erbil. This is Jordan map, and Erbil is located north of Jordan. After zooming, the other map is for Erbil, and at the center is Hakama. And the big map is for it's a real view, a satellite view from of Hakama, the village. And as we can see, there was a specific clustering in the eastern district of the village. So the control measures implemented were represented in four main points. First, treating the patient and their contact, family members and visitors were offered prophylaxis. And entrusting dermatologists, public health professionals, and family doctors to work in the health center throughout the week. Second, the educational campaign were conducted in Hakama and the neighboring villages, and which include the awareness brochures, the lectures for students, their parents, and teachers. Also visiting the private clinics to raise awareness about the outbreak and the illness. And media or risk communication helped in controlling the outbreak. So as we have seen, the outbreak started several weeks earlier. So it was like a delay of diagnosis and of treatment that enhanced the outbreak. The most affected age group was the age school group, which is a consistent result in the Eastern Mediterranean region. Syrian students are the most affected ones in Syrian schools where conditions of overcrowding exist. Actually, the study has two limitations, the two last ones. The primary goal of an outbreak investigation is to identify risk factors contributing to this outbreak in order to take corrective action to prevent further transmission. So our limitation was not to be able to identify risk factors and conduct a more appropriate study design. And the second limitation was searching for the index case or cases. So in conclusion, scabies affect mostly the school children and predominantly the Syrian students. And the outbreak was enhanced by the poor environmental condition as a result of overcrowding in schools. So as recommendations, scabies is no more a forgotten disease. Establishing surveillance of scabies and increasing awareness and educational lectures about scabies during health school visits are prerequisites. And finally, conducting further studies to identify risk factors is recommended. This is special thanks for all directorates that participated in controlling the outbreak. And thank you.
Thank you very much for this very clear presentation. Then the floor is open for some questions. Yes, Doctor.
Thank you for your nice presentation. In fact, scabies is not a concern in Jordan. This outbreak has raised our concern. After you did the outbreak investigation, you mentioned that for the shortage of time, you haven't recognized any risk factors. But I think we heard about some risk factor regarding the lack of water.
Yes, this is in the control measures implemented. it is known that scabies is a water wash disease, so we actually increase the amount of water, especially for Syrians. The fact that we did not search for other risk factors, that this is a descriptive study, and frequently the descriptive epidemiology is conducted in acute health problems such as outbreak. Other analytical studies such as case control are planned studies. So at that time, our top priority is to control the outbreak, because people were started to moving out of the village, and we was under the pressure of media, the pressure of Minister of Health. So yes, I agree. Descriptive epidemiology generate hypotheses that should be tested by analytical studies, and for this, I put it in the recommendation as conducting further studies to identify risk factors.
Then Dr. From Egypt, and after that I will go back to follow. Okay.
Thank you for your presentation. Please go to the case definition slide, please. In refugee camps or communities, we expect that coexistence of more than a disease may happen. So if one outbreak happens, the another slide for case definition.
The case definition.
Yeah. So we have another disease may happen among these communities, like measles, like rubella, something like that.
Yes.
So we have more than 1 month, I think, your investigation. So keeping this case definition like this, without keeping in mind that any possibility for a case to have measles, for example, or rubella, because measles or rubella, as you know, is with public concern, and this case definition may mask or delay discovering of other outbreaks from these diseases. So if we have an outbreak sharing signs or symptoms with another disease, we have to share to this for like your case definition here, we have to add not diagnosed as blah blah blah. Okay.
You mean that the differential diagnosis?
Yeah.
Okay. Okay. First of all, if you are talking about measles, the case definition of measles is very sensitive, and it's fever plus rash, and fever is not in the symptoms of scabies.
But here, during active surveillance, the mind in this area is directed from my side to go to search about these cases.
Yes.
The physician will find a case like this, even if it's measles or rubella, will direct the case to be suspected case of scabies.
Of scabies.
Forget about others. So we have to put just
Differential diagnosis. It was a developed case definition for the outbreak. We covered the place, person, and time as required for a case definition. Again, this measles or rubella are notifiable disease with a sensitive case definition, and this is a limited case definition with time. It's from February 1st, and the place, it's in Hakama. So the cases was confirmed by the skin scraping for microscopic examination. So this is the confirmed case definition, and the other cases were confirmed by epidemiological link.
Okay. I think scabies is more severe in to elderly people, and they are more. They have. They are more. To give infection to other person. They are more infectious to other person,
Okay.
and they may be source of infection in the community.
Yeah.
I want to ask if you have any notes about this. Okay, thank you.
Okay, if we can go back to the age group, the distribution by age group, the sorry, the most affected age group was the school age group. It was not the elderly, which was less than 10%. So we focused on the most affected age group. I agree with you that the older people are most vulnerable to infectious disease. But we are talking of this outbreak, and the most affected outbreak is the age group. This age group, the most affected.
This is the percentage of the total cases.
Yes.
And this not represent their, their, their number in the community.
But this is the percentage. This is the percentage of total cases. Yeah, this is of total cases, and we are dealing with this outbreak, not the community.
And not attributed to their presence in the community.
Okay.
Okay, then we will take the question from the back of the room. Yes?
Okay, thank you very much. That was a very interesting description of an outbreak. You followed all the steps, and you could really, in the discussion, explain very clear why was
Thank you.
this the case, why was this the case definition, and how you were able to go through the whole process. But my question is, are you sure there is no more cases appearing, and there has been a definitive control of the outbreak?
Yes. Yes, the cases seems, or the epidemic curve seems that is a point source outbreak, which is not, because cases were clustered over time because of the active surveillance. I mentioned earlier that the mobile clinics in schools and house-to-house active surveillance, every single house were visited and detect cases. And after that, the cases were scattered over time. And we all know that the incubation period of scabies is long, 2 weeks to 6 weeks. So it was 1 month. So of course, we had cases after that, but it was scattered. Yeah.
The nature of the disease is a little bit different from other communicable diseases. In general, it is not public health threat or public health problem. It is a parasitic disease.
Yes, effective.
And regarding the case definition about rush, it is rush due to itching, especially
Yes,
during
yes,
breastfeeding.
itching. Yes.
So, yes, that is other issue. Another thing is that we never can be sure that this is beginning and this is the end, because the disease most of the time it is among family members,
Yeah.
and most of the time it is hidden and it is purely non-hygienic, let's say, disease.
Yes.
Okay. Thank you for all of you for this very